My name is Mark Sitarz. I'm the fire chief and emergency manager for the city of St. Anthony. So when it comes to emergency management, we do a lot of planning and we do a lot of preparedness. And one of the plans that the city has is for a pandemic. We work in conjunction with our partners, the Minnesota Department of Health, uh, Hennepin County and Ramsey County Departments of Health, the state of Minnesota, Homeland Security and Emergency Management, as well as Hennepin County Medical Center. These are things that we focus on, and we do look at the big picture and make sure that all of our residents are taken care of. These are plans that we put together to make sure that all the residents of St. Anthony and surrounding communities are well taken care of, as well as prepared for something as significant as this. As community members, I think the best thing you can do is to listen to valued sources. As I stated, we work in conjunction. Our official is the Minnesota Department of Health. And if you can pay attention to their messages and take this seriously, it's one of these where, again, we do have a plan, but part of our plan is that residents are cooperating with notifications and with recommendations from these health experts. When something like this takes place, part of the plan is the potential for a modified response. And there's varied levels of response. What a resident can see, depending on our level, is we would come up potentially in personal protective equipment, or PPE, and we would limit interaction with that resident. We would do what's called a threshold assessment, where we would stand in a doorway and we would be at least 6 feet back, if not further. We would have a mask on if there was an open area between us, if there wasn't a door or a window, and we would talk to you about your symptoms. And prior to us getting to your residence, our dispatch center has already been in contact asking you certain questions so that our folks, the responders, are prepared and have an idea of what they're dealing with. So we take this seriously. This can be intimidating, but it's for our safety and it's for your safety. So this is, again, not ordinary, but this is part of the plan. As I stated, my advice to residents is to follow instructions as best you can. I know social distancing can be long and it's uncomfortable and it's different because usually we can go to the store or we can go to the restaurant whenever we want. And right now, that's not an opportunity. I do feel that mitigation fatigue also can kick in, where people hear so many messages that they have to stay in their homes and you have to social distance. But again, I would ask you to take it seriously, protect yourself, which will help protect us. And if you do need 911, we're going to be there. But just understand too that things are going to be a little different, but we're still going to show up.
My name is Chris Palmer. I'm an emergency medicine physician at a local ER. I'm the medical director of a level 1 trauma center, and I work for Emergency Medicine Physicians Associates. This is a kind of a typical process for us. Yearly, we drill on large-scale disasters, whether it be trauma, radiologic, environmental, or other. So this has been something we've been prepared for a while. Obviously, we're continuing to prepare extensively for this particular event, but we have the facilities, we have the people, we have the planning to be ready for something like this. Sure, the word social distancing has become a new lexicon at this point in our life. So if you can maintain some distance from each other, simple things, covering your cough, washing your hands. At this point, probably avoid handshaking. Um, and then it's really about supporting everybody else. So if you are ill, the best thing you can do for your community is keep yourself away from others so you don't spread your illness, particularly for those who may have health conditions. Avoiding those individuals can be very helpful. That's a great question. Things are very different right now. When you enter a healthcare facility, whether it be a clinic, hospital, emergency department, you may be asked immediately whether or not you have any fever, cough symptoms, and have a mask placed on you. I think you need to be ready to be cared for in unusual care facilities. So we have a disaster area with a decontamination unit. We have that all set up ready to care for patients. And so that's going to feel a little bit different than what you're used to, having a bed in a private room. So we have to be flexible and understanding to the fact that based on your illness, we may need to care for you in a little bit different fashion than what you're used to. Most common symptoms are fever, cough, and shortness of breath. There are some individuals who have some GI illnesses with it, so diarrhea, some nausea, sore throat, and headache are by far are also common, but definitely the most common would be fever and cough. The best thing you can do right now is just try and be healthy. So you should not sit on the couch and watch TV all day. You should try and exercise, eat healthy, make sure you're getting rest, um, avoid others if you're feeling ill. I think try and control the things you can control. Spending all the time you have thinking about the things that could happen isn't really healthy for you. So have some social interaction despite the social distancing is also valuable. Sure, mild symptoms are very similar to kind of a bad cold. And so for most bad colds, people would not seek healthcare. And that should be same for this. So if you have a fever that's easily controlled with Tylenol, if you have coughing, if you just don't feel real well, you feel kind of achy, that's a pretty normal portion of this illness. And you shouldn't be terribly alarmed by that. Things to watch for, what are warning signs? Are you getting short of breath? Particularly, are you getting short of breath with rest or minimal exercise? If that's not normal for you, that's something that should prompt you to contact your healthcare providers. The same symptoms you'd look for in any other person in that individual. So, is there a new cough that's not been present before? Fever's not controlled with Tylenol. For infants, they tend to get lethargic if they're quite ill. If they're not feeding as well or wetting diapers like normal, those would be indications to contact your healthcare provider. Step one would probably be acetaminophen. At this point, there's some very loose evidence surrounding ibuprofen, probably not enough to actually make a health recommendation for. So if Tylenol is not adequately controlling your symptoms, certainly using ibuprofen at that point would be very reasonable. Safety is mostly revolves around public health. So, are you washing your hands? Are you covering your cough? Are you doing the kind of things you should be doing anyway to avoid infection? Most 55 and older facilities have action plans in place. We personally tried to visit my in-laws recently, and we're not allowed in because of that very restriction, which is a very good healthcare move by these institutions to try and prevent illness for their more susceptible population. And so I commend them for doing that early and getting on top of this situation. So in short, I don't know that I can really recommend home versus their own home versus their child's home as a location. It's really about healthcare preventative measures. There's a lot unknown about this virus in general. I don't think we really have any definitive information about that. There's certainly varying levels of illness that people get with the coronavirus, anywhere from mild cough to severely ill, as we've seen demonstrated across the world. I think there's a couple of things that the community can do to support their local healthcare facilities. One is if you're mildly ill, try and avoid the healthcare system at this point. There's not a great management or anything we particularly do for people with coronavirus and mild symptoms. And so staying at home, taking care of yourself, treating your symptoms would be what we would recommend at that point. So if we can keep our healthcare facilities free for those that do suffer more severe illness, that's very helpful for us. I just did hear recently as well that there's a shortage on blood products locally. And so if people are healthy and well and don't have chronic health conditions, if they can go out and donate blood, that can be life-saving for somebody.
Hi, villagers. I'm Megan Keynes. You know me. I'm a villager first and foremost, and a daughter and a mother. And I also work in public health as an epidemiologist and an emergency responder. Well, the ones that we typically are hearing are fever and cough. And the fever really is the predominant one. And that's for a lot of different infectious diseases. In this case, if you have a fever and shortness of breath, that's when we start to feel concerned. There's kind of two questions going on there. One is a question about how we do routine infectious disease surveillance, and the other is about how to interpret what we're seeing every day. We will see the numbers lag behind what we understand to be really going on the ground now that we've transferred into community transmission. When we're in a state of community transmission, we assume we're only seeing a few cases, and that's normal. Our surveillance system is set to take a number of tests that are respiratory infections on a certain number of samples, and we continue to do that kind of surveillance through the Minnesota Department of Health. And as tests become more difficult to get, or components of tests so we aren't able to do testing, the testing protocols can change, but it doesn't mean that public health isn't watching and keeping a pretty good handle on it. Our standard answer on a lot of ways that public health data is collected is often not as personalized as people hope it would. Sometimes we see when people go to the hospital, but we don't see when everybody who stayed home with the flu and never got a test was feeling okay. And it's common that we get both of those questions together as people are trying to picture what their daily life is going to look like. Today, I'm in a room with people outside my family. We've stayed 6 feet apart. We've even had some jokes about how we're going to bump our elbows or shake our feet at each other, or whatever it is to do to remind ourselves to keep that social distance in place. That's okay. If you've got someone who you're quite close to and they're asymptomatic, that's okay. We really want to emphasize that it's a balance between social isolation, quarantine. I've told my kids to hang out with their siblings mostly, but we did go play an imaginary football game across the street the other day. There's a balance. The second question is what to do if somebody in your house gets sick. If someone in your house gets sick with a fever, just in general, we often hope that people will, one, stay home when you're sick. That's very important. Two, practice extra hygiene. That means get out the wipes, wipe everything down, make sure you're washing your hands. Now, that's standard regardless of the pathogen that caused the illness. We, in our house, and something that we've been recommending is that if somebody has a fever, see if you can self-isolate within the house. That means don't share your drinks. I think you've probably heard that before. It means don't hang out in the living room to watch Netflix unless nobody else is there. It means stay in your bedroom and get better. If there are close contacts of the household, we want them to closely monitor their own symptoms and reduce their movement for about 14 days after. That could change, but we're being cautious right now. I've heard this question a lot too lately, and no. To get an effective contact, a number of things have to come together, and it's not usually I work with somebody whose spouse is sick. That's kind of stretched out. If you work with the person who was sick, we do want you to monitor your symptoms, but if you weren't around them when they had a fever or coughing, then it's far less likely that you had an effective exposure, which would result in illness. Well, we always try to leave ourselves an out to say, well, maybe you got food poisoning in there. But yeah, after 14 days, if you don't have any symptoms, it's okay to relax. There's a couple parts to that answer too. I'm glad that you asked. The surface is an ideal surface, like a smooth countertop, where we think, evidence suggests, about 3 to 4 days. It's a fairly fragile virus, though, and so when you wash your hands with soap, that's actually a very effective way to get rid of it. Additionally, you would want to follow your regular disinfecting procedures. You could use a gallon of water with a cup of bleach. You could also use peroxide or ethanol wipes, alcohol, if you have lung issues that would prevent you from using bleach as a disinfectant. That's one too that we checked on today. The Minneapolis airport is still in operations, and flights from Americans to Europe are not recommended right now. It's one of those things that's going to become evolving. The governor and the mayor have recently put out emergency proclamations and resolutions that have changed our way of life and our relationship with a lot of businesses, a lot of our vacation plans, and a lot of the ways that we structure our life. It's one of those things where if it has been closed down, you will see people from the state or the city or the county or the many, many public service workers that keep your life going, working and helping the restaurants and the pools and the adult daycares and all of these businesses to understand what's being asked of them at this time. I hope that you keep the part in where I laughed, because I just had the superintendent looking at me with a very intent look. I think she wants to know too. A week ago when we were talking, we talked about how the state was not recommending that we close schools at this time, and then 3 days later we were watching the schools close down. It's really evolving. What I can tell you that I've been impressed with is that the Minnesota Department of Education and the Minnesota Department of Health are working hand in glove. I like to watch the governor's pressers every day, not only because I think the interpreter is fantastic, but I think that he provides the information and he provides the people access, direct access to the people from his staff who know their stuff. So that's where I've been watching it. I don't have a crystal ball. I'm taking my guidance from what our state says, and then I take that guidance back down to our counties and our cities and try to understand what that means for us. How bad is it going to get? Governor Walz said recently that this could be one of those restructurings that's similar to World War II when everybody had to pitch in various ways. I think that's sort of the way I'm thinking about it, is restructuring and doing the best for our most vulnerable community members. I think it'll make us stronger. We've gone both ways in my family. My mom likes to use grocery delivery services, but we have had a non-negotiable rule that the dog does need to be walked. He's gotten more walks than he's gotten in a long time. Please go outside. Please look after your mental health. Please look after your social isolation. These are things that are real dangers when we're in this kind of a situation, and we want you to be out and about. Now, it would be great if you weren't close on top of each other while you were out and about, but we have state trails, we have parks. Our beautiful Central Park in the center of our city is a huge space. Surely we can all find a little way to get some outdoor air out there and maintain our social distancing protocols. We can do this. There are a lot of people who spend a lot of time thinking about how to do this. I'm one. This is my area of interest. I work for the city government and I think about this all the time. We have people who collaborate all the time. I was joking with the fire chief a few minutes ago that this is the land of 10,000 collaborations. We all work with each other, we're well practiced at it, and we're leaning forward into this. We got this.